let's understand the case. So I would like to make you understand functional medicine from demo point of view, from the case point of view. So let's meet this girl. She is Tina. She is 24-year-old, and she came to the clinic with 100 kg of weight. She has a obesity, and most of the weight is around thigh and around the abdomen. She is also complaining about the delayed menstrual cycle, almost 6 months, and whenever she has cycle, she is suffering with the cramps and pain. That's classically, we can say, premenstrual symptoms. She's also expressing anger and irritability. She's also having acne, hair fall, and it is worsened in last 1 year. So if same patient, like I said you, if the same patient goes to the conventional medicine doctor or allopathy or gynecologist, what is the linear thinking? See, I'm not against allopathy or against homeopathy or any medicines, because I consider the functional medicine is foundational operating system, and I would like to change your paradigm. I would like to change your thinking, so you can think about the case in a different way. So if this patient goes to a conventional doctor, then what is their thinking? So first thing, they will do ultrasound. And as we see, these patients go to the ultrasound and they find out the cyst. And when they find out the cyst with all the symptoms of acne and hirsutism and obesity, it's called as a PCOD. And this patient has got a diagnosis of PCOD, and then what? PCOD because she doesn't have menstrual cycle. So conventional linear thinking is we want to prescribe the oral contraceptive pills. Yes, oral contraceptive will help, and that will regulate the menstrual cycle. So we are going to bypass the real hormones that is produced by the ovary, and we want to give external hormones. The oral contraceptive pills is the treatment of choice for menstrual irregularity, and this patient end up with an oral contraceptive pills. But that is not the end of story, because patient complain about the weight. She is not losing the weight. So what is our thinking? Let's prescribe the metformin, because metformin is known to decrease insulin sensitivity, it increase in weight loss. Yes, that's good. That's a medicine that can help in that, and we prescribe the metformin. So that's the metformin. And so here I want to show you the linear thinking, right? So not losing the weight, just think about the pharmaceutical. What pharmaceutical help in that particular conditions? So we want to give that medicine. So it's a metformin. And then again, year after she came and she complained about the infertility. Now she cannot have a baby because she want to plant the baby. So now what is our thinking? Let go for IVF. That is even not the end of story. Even IVF is important, and IVF can help in pregnancy. And we a lot of IVF center around the world. And right now we see a sharp rise of infertility, and there are multiple causes for that. But here I want to show you the linear thinking, that if the patient end up with infertility, and we can prescribe the IVF. But that is not the end of story. Again, few years after, she developed diabetes, because we know PCOD or PCOS patient, they are having a high risk of developing diabetes. So again, she end up with a diabetes years later. And then what is our thinking? We want to prescribe the anti-diabetic medicines. This goes on and on and on. And this is what our conventional thinking and conventional medicine approach. We never think about the root cause. What could be the possible cause in PCOS, and how we can think beyond pharmaceuticals. What is the reasons, or what we can do further so she can reverse PCOD.